Bulavinaka, namaste and good evening. You're watching Fiji Village Straight Talk. I'm Vijay Narayan, and tonight we are talking about breast cancer. It's Pinktober. A lot of awareness sessions are underway around the country in different forms, mainly led by the Fiji Cancer Society. It's not just a month that we should be talking about this issue. We should be talking about it all the time. And one of the issues that is affecting many people in our country, many families in our country, and we have to continue to stand together to ensure that we understand this issue fully, and that is the reason why, based on demand and calls made to Fiji Village Straight Talk, I have today managed to get the clinical nurse for Fiji Cancer Society, Karolina Tamani, and stage 4 breast cancer survivor Mele Koroi in studio to talk to us about all these issues relating to mainly breast cancer, but we will also be talking about other cancers that are affecting people of this country. So again, thank you Nurse Karolina and Mele for agreeing to come on the show. Now, a lot of people are talking about how are we faring in terms of the number of breast cancer cases in the country. Nurse Karolina, you've worked with the Ministry of Health, have been heavily involved in taking the word forward on cancer prevention as a worker of the government first, but now with the Fiji Cancer Society, you have gone through many years of experiencing this. What have you noticed as far as breast cancer cases are concerned?
Thank you, Vijay. In terms of noticing the number of breast cancer cases, we will be able to confirm that the number is increasing as years goes. It is approximately at the moment over 300 cases a year, because we are not only looking at the breast cancer in women, included is breast cancer in men, which is also on the rise at the moment.
The issue there also, as far as breast cancer is concerned, the fact that people are saying that it may just affect women. We know there have been cases of men. If you can talk to the people about that.
Yes. Years ago, it is believed to be a disease of mostly women, but as time goes now, we are also getting cases of breast cancer in men. The symptoms may be are almost the same, because it starts off with a lump, and then the number of men, because it's not been reported, and now that they are aware that men is also having breast cancer, they are coming forward to seek advice and be screened as well. So that is one of the reasons the number is increasing.
Mele, you are stage 4 breast cancer survivor. We will talk about your experiences, and people can learn from that on how you have managed to become a survivor. But first of all, around 2012, you said, when you first found out after an assessment being done, prior to that, how much did you know about breast cancer?
Thank you, Vijay. Well, back in 2012, my knowledge about cancer was not that big or that much. Only I knew is that breast cancer kills, and mostly when you have cancer, surely you'll die.
So your understanding was, after you diagnosed with cancer, there's a natural death that will follow.
Exactly.
The reported cases, we know that you were saying, Nurse Karolina, that it's about over 300 cases per year. Are the reported cases increasing?
There is increasing, because more women are coming forward. that is one of the reasons it's increasing. Whereas in previous years, women decide to stay home and seek herbal to be treated, and those are the cases that were not reported. Now that the awareness that has been done by the Fiji Cancer Society, advocacy right into the village level, are bringing forward these cases of just identifying a lump, which later on can be confirmed, because not all the lumps are cancerous. So the increase in the number of confirmed after doing biopsy is the one that helps get the data, because now we are also looking at data. The data gives us what we put out in statistical forms.
Mele, you know that now we're talking about going for the examination. If we can go there in 2012, what made you take the step that you need to get tested?
Well, I felt that pain under my right breast, like it was going on for like 3 to 4 months, and I decided to go and see the doctor. So when I went to the hospital, I had the test called biopsy, and that's where they'll see or detect whether you have the lump, and it was confirmed. After that test, it was confirmed that the lump was there, and it was like 2 centimeters above. So from then, I went back home. I was not receptive to what I was told. So from there, then I decided to do other options.
You did not accept the test result?
Yes, I did not, because my mind was like running around, and all that came into me was cancer kills. So I didn't want to believe it, and I was taking that options that there could be other options to which I could take.
So you didn't want to turn to the medical option?
That's right. So it was like 5 years from the time it was detected. I was looking for other options, and one for that was herbal treatment.
We'll talk about that. So when you were assessed and the determination was made, you're saying you were at stage 1?
That's right.
Stage 1, yeah? Okay. Nurse Karolina, you have talked about reported cases increasing, more women coming forward, men also coming forward, wanting to know more. Why has there been an increase?
I believe, Mr. Vijay, the increase is because we are reaching out, and also this platform that you have from this good organization has given us the privilege to share information that helps an individual come forth to seek our services. So the platform that like Fiji Village is doing now, and then we have our social media, our Facebook page that we put this, and then the community awareness, we reach into the villages, we reach the faith-based organizations, we also reaching out to the tertiary levels, so that the information regarding what to know about cancer, what are the symptoms, these are some of the information we share during this kind of advocacy, to be able to help the person knowing that there is a change in his body, come forth and seek second opinion regarding it.
From your perspective, and I'll ask both of you, what do you think are the major causes?
Of the increase, you mean? It is the information that I believe, it is the information that has come through. Whereas previously, the reason to fear cancer was that because we do not know. Like Mele said, it is cancer kills. And then with the information, we show them the package that if you see changes in your body, or if you detect something that is abnormal, go to the nearest medical center or come visit Fiji Cancer Society. So that builds a sort of assurance to the people to come forward. I can seek information to be able to do the right thing. Yeah.
Mele, do you think we are doing enough based on the major increases now being revealed in the yearly statistics?
Yes, I think the medical department has done their job. They're doing many awareness throughout the countries and through villages, and even in the city here in Suva, we're going to companies and tertiary bodies of governments where they go and do awareness. And as for me, what I've experienced, like Fiji Cancer Society has been doing a good and great job in doing awareness and providing all sorts of help to us cancer patients.
If I was to ask both of you, what more needs to be done? Definitely more can be done. From your perspective, what more needs to be done?
Thank you, Mr. Vijay. From my perspective, we're looking at early detection, but then we have to show them where they will get the treatment and management. So I probably may look at the government. Okay? The government needs to commit to help the Fiji Cancer Society or other organizations that are doing cancer services in terms of ensuring policies are laid down or are provided, funding is done, more training to the service providers, specifically the nurses, the doctors who will look at doing the operations, lab technicians who will process samples for, that need to be processed timely in order to get the management done in a timely manner as well. So more to be done is the commitment of the people to come forward and say, okay, we will talk about it. Let's talk about cancer. Let's not put cancer behind the scene, because our loved ones are dying of cancer. Mothers, fathers, grandfathers. The teacher is dying of cancer. The doctor is dying of cancer. A lawyer is dying of cancer. So if we as a human race are affected by this disease, why don't we just come in, sit together and say, okay, we'll fight together.
I'll ask you about when you were diagnosed first, you went to the hospital. Things may have changed now for the better, or may still be the same, or may have gone worse. One of the issues is when breaking the news. It is quite a major issue for the person receiving the news when they're told, okay, the assessment has been made on this lump and it is cancerous. And definitely the next step is proper counseling and how to handle the situation. What did you go through, and where do you think things can be done better?
Well, as for me, after I received the result from the doctors, I could honestly say that I was blank. I was blank, and all the thoughts that came into me was negativity. And through that experience, and I happened to learn again from what I went through, and I was encouraged by my family, with my husband, to take the step forward and don't sit there and think the other way around. So I have to come up and seek medical advice, and look for some counselors to counsel me. So I happen to have enough confidence. Then I came to some doctors to give me information, so I took the step from there.
But at one stage you were in a limbo, trying to turn to other means.
That's right.
Just a question, Nurse Karolina, on you talked about the government commitment. Two things I want to ask about. One is the equipment needs and the needs as far as skilled workforce is concerned. We have a big issue in that area. The other one is funding. Now, in terms of making sure proper funding is provided towards the health sector and towards organizations like Fiji Cancer Society, if you can elaborate on that.
Thank you, Mr. Vijay. That is a very true concern. Fiji Cancer Society is a non-governmental organization, and our funds to operate, to reach, to implement the plans is made possible by the corporate bodies like New World, Tapus, Motibai. These are the companies and the generosity of the whole people, the people of Fiji that donates in kind to help us reach. We are made. So we are saying that we are non-governmental. Until today, there is no commitment by the government to fund. But if you had been in the launch of the Pinktober campaign by the Ministry of Women, fortunately the Minister for Finance was sitting there, and they have committed to do something next year. So we are very happy and grateful to that. It's because we continuously advocate. We advocate because our loved ones are the one that suffers from cancer. And then to continue support for them. Right. The next thing is to look at the facilities. We need to have referral centers whereby the women who are, the client is referred to are given timely management, because we know and understand that the more the delay, the chances of progress is, a lot. And we want the people to be receiving timely treatment and management. So we need the facilities. We need skilled people to do the operations, to do the processing of samples, and we need the nurses to do the screening for early detection. So it covers a lot of commitment by the whole nation to be able to make it happen.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
I've always resorted to drugs because of the work that I do as a coping mechanism.
You said you started sex work and drugs at the same time?
I was 12 years old.
Do you believe, based on the current situation, your salary and allowances should be reviewed and reduced?
Definitely, I think it should be reviewed to reflect what is there in the market.
Is the government of the day promoting nepotism within our community and hatred towards Indo-Fijians?
Thank you very much. The answer is no.
$1 in $3 of our taxes goes towards servicing our debt. So you can't say it's nothing.
There's also the need to do financial inclusion a bit better.
What is your message to the people who may rate you as not good enough for finals rugby?
Success doesn't just happen overnight.
Fiji Village Straight Talk with Vijay Narayan, brought to you by the Ministry of Health and Medical Services.
Welcome back. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guest tonight are Fiji Cancer Society's clinical nurse Karolina Tamani and stage 4 breast cancer survivor Mele Koroi. We are talking mainly about breast cancer, increasing number of cases, and it has been confirmed by the Fiji Cancer Society, mainly through the awareness campaigns that they are running, going all out to different parts of the country, villages, settlements, to corporate organizations to try their very best to get the message out, and also hoping on this show, as they've said, that proper government support comes through to Fiji Cancer Society so that we can do more and more. Now, we talked about what more needs to be done. We also have to talk about when the news is revealed to the patient, and of course treatment will be required, the proper treatment, and how do patients react to it. It would be fitting for Mele to talk about that, as she was sharing her story that when she received the news, she just thought of darkness and of death. Mele, how did you deal with that?
Thank you, Vijay. After staying home for that quite a long period of time, the lump got worse and it increased and it burst. So from then I was like, there's no other option. I'd better turn myself up to the hospital. So when I went to the hospital, I was so lucky that doctors can give their time to treat me, because they know in the first place I was like running away, and after 5 years I came back, and due to the best services of the doctors and the nurses at CWM, treatment was done. I had my surgery and operation was successful. So it's after 5 years again, from then till today, I survived the treatment, I survived the disease, and I'm here, and I'm so proud to be here to advocate to other women that cancer can be treated only if you would have come earlier in the hospital. And
we're talking, Nurse Karolina, we're talking about patients finding out first. You definitely would have been in that position many times as a nurse working for the Ministry of Health, and now with the Fiji Cancer Society, dealing with the patients who are to be told that they have cancer. What has been your experience like, and how can the best possible way be used to ensure that you get people getting into treatment rather than turning a blind eye to it?
Thank you, Mr. Vijay, for that. That is a real concern with us, because once told, because of the rumors of cancer, once told, there is a step back to come forth and continue. But we try our best in the clinic to ensure that as we identify the lump, which is our job, we counsel them to be able to have the trust in the services that we do to continue, because there is each step of the way that needs to be we go through to be able to reach the final treatment. So one of the examples is that we tell them that we just need to confirm the lump, if it's cancerous or not. So then we also tell them of the steps they need to go through to be able to reach the confirmed diagnosis. So, and then for us, simple things like giving them a phone number. You can bring your husband or partner the next time you come and visit us. And we also have sometimes from Fiji Cancer Society, we direct them straight to the clinic. And with the network that we have with the Ministry of Health staff at the CWM hospital, we also put them through, so that there is no anxiety along the way that will give them the chance to step back. Well, then I'm looking at the issues that you have here facing the patients. So information, once the lump is identified, we ensure that we will support, because our mission is to let no one fight alone. We will be with them along the way until even after they have been treated. So sometimes we look at those things as a burden. They will already have some kind of mixed emotions in their mind that will say, okay, no way, I'm not going to go for treatment. So they will seek friends, they will try to confirm the rumors to them. So we said, rumors are not to be believed. Okay, because those myths will just let you fall into a late stage presentation. For families, sometimes the family are lost as well in the initial identification of the news or in the initial stage. But when we bring families together with us, they are able to give that support, because lives can be saved if we act early.
We'll talk about family support now. There's been news also of some family support not being there, even husbands deciding to leave their wives after finding out. The emotional distress that the patient goes through by then their life partner maybe leaving them during the most challenging times. How have you dealt with cases like that?
Thank you, Mr. Vijay. Family support is one of the most important part in the healing process. So along the way, because as the disease progresses, and I would call it a burden to the family, because the mother or whoever is affected is unable to do the normal things that she can do to the family, to the husband as a wife, to the children as a mom, or to the society, to the church they live in. So they become unable to do what they usually do. That is a burden. And if she was a working mother, she will not be bringing home that pay packet that the father or the partner also depends on for the running of the family. It's a bit okay, maybe I may say that because of a relationship of the couple, that part of life will not be 100%. Because of the pain that the woman is suffering, she will not be able to present herself fully to the husband for that part of the relationship. And then sometimes, because they cannot accommodate the husband's desire, the man tends to look elsewhere for that part of satisfaction. And that is added burden to the woman psychologically. Already there are things running in her mind, and that will drop her level of trying to coping with the disease. Yeah.
Are we getting many cases like that now?
Like I said, the few cases that have come through, we are aware. We also do counseling, though we don't have professional counselors. That is another gap, that we may need to have professional counsels in the area of cancer healing process. And maybe there are women who are suffering quietly in addition to the disease for not being able to satisfy. Cervical cancer, breast cancer, they are sort of still hiding it and yet to come out with it.
You did say that you have had cases where the women turn to the men on whether they should get treatment or not?
Yes. I would say honestly today and publicly that is one of the gaps that we have. That is one of the challenges that we are having from screening. Once the results comes out, we advise, we counsel the women regarding the result. That is just the result of the test, not yet confirming cancer. So once those results come in and we say there are changes in your body that may lead to cancer but yet to be confirmed with other tests. So the women, they run to the husband, and the husband's reply, don't go. But for me as a clinical person, it hurts me to hear those kind of statements, because I know the changes in the body will not stop, because there's already a virus, or there's already a condition there that needs to be managed and removed. So since they have listened to the partners, we have no choice. We are not forced to go. We have to respect their rights for treatment and what is done to them. So we stay back.
So unfortunately, some of these women have passed away because of that.
Some of the women have gone through those bad stages and actually passed on because they decide with the approval of the partner. And I would like to ask all the partners, if one thing that you can do, support the wife, because the battle is not hers alone, it's for both of you.
Mele, you are a stage 4 breast cancer survivor. How important is the support of the family and especially your partner?
Vinaka Vijay. Well, with me, I was so fortunate that family support was overwhelming. We went through thick and thin together with my husband and my 5 children. They were there by my side to encourage me and give me supportive words to carry on, and telling me that I'm not fighting alone. They will always be there for me. And my children at that time, they were still in primary schools. And I know they have little knowledge about cancer, but they were there, always 24/7. Whenever I need anything in the day or even in the night, they were all ready to support me and there to pet me and tell me, Mom, it will be okay. You'll be fine. We'll go through this together. And I was so blessed to have a very supportive husband who's always there and telling me kind words to empower me not to lose hope and have faith in God. And that was one of the biggest contribution also to my healing, that I can be still here today and challenging other women and also husbands out there. You have to be very supportive and always be there when your wife is dealing with cancer.
Nurse Karolina, you talked about the real need for early detection. How important is that?
Yes, thank you, Mr. Vijay. In terms of early detection, we mentioned about the ability, the services that are currently available. And then early detection helps with the survival rate. Okay? So if you are coming at a late stage, for example, your body itself is not able to cope. Okay? And then with the current system that you have to go through these tests, turnover of patients, and also availability for surgery, and also if your body is able to manage after operations. So that is why we focus on early detection is the best prevention, because it's curable when it's detected early. Yeah, and so also that financially, if you are able to pay for some of the expenses to travel to India or to other countries that are high in technology to treat, then there are chances you will survive, but at a very late stage. So we want to treat them locally with whatever is available in the country, and then to a lesser expenses rate to the family and the nation.
What's your message, Mele, in relation to early detection?
Yes, for me, it was a lesson learned that early detection is the best action to take. Because as the saying always goes, prevention is better than cure. And also, with my experience, the earlier you visit the hospital or have your treatment done, the better.
Issue about a lot of people turning up late. You're saying that then it diminishes the time frame, the treatment available in the country. We have had sessions where people have said that is one of the biggest concerns the Cancer Society has raised. Do you think a real massive campaign needs to take place to ensure that people realize the importance of not turning up late?
Certainly, Vijay. I know we are live, we are presenting live, so if there is a message, we need, as I said earlier, we need to come together as a nation, not only Fiji Cancer Society, as a nation, to tell the people, your normal body, you must know. And if there is a slight change in your normal body structure or normal change in your life, say for instance, I'm saying, if you see abnormal bleedings, for a woman who have normal menstruation for 3 to 4 days, and if you are bleeding, that is abnormal, if you are bleeding more than the normal days. So once you identify any abnormal in your body, or for men in prostate cancer, your urination problem, you identify those changes, please visit your nearest health center. Yes, we must collectively advocate, the media, the government, and all those involved, because cancer does not discriminate. It affects every family, okay? It affects all human beings. As we live in this world, we are at risk. So it is a war that we should do. It's a fight, that we should do as a nation.
We need to win.
And we need to win, because we can win.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
Get ready to elevate your event with Total Event Company's top-notch gear hire services. From a stunning 12 by 12 meter adjustable stage and impressive 13 by 13 meter production roof, we've got your event covered. Our gear can fit any venue, big or small. Need tents? We offer 3 by 3 meter pagodas, 6 by 3 meter tents, and a grand 15 by 30 meter marquee tent. Turn your vision into reality. Choose Total Event Company for gear that makes your event shine. Visit the Total Event Company Facebook page or dial 3314766 to get in touch with us.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan, and tonight we are talking about breast cancer and other types of cancer affecting the people of this country. Fiji Cancer Society's clinical nurse Karolina Tamani, who's done a lot of work over many years, working at the Ministry of Health, working on cancer prevention, awareness campaigns, and now with the Fiji Cancer Society with us here tonight, and also stage 4 breast cancer survivor Mele Koroi, talking about her personal successes and challenges on a journey as she was diagnosed with stage 1 cancer in about 2012, and then finally getting treatment at the stage 4 level. We'll be talking about herbal medicine. Seems to be another issue that at times is concerning the health authorities, where people turn to herbal medicine on its own after finding out news that they have cancer.
Thank you, Mr. Vijay. That is very true. And I must say here that herbal medicine is not scientifically proven to treat cancer. But as a choice for the individual who have been diagnosed with cancer, they need to look at something soothing, and they continue to do that. But I think the message that I will mention today is that a lot of people turning to medicine do not realize that the longer they stick on the herbal medicine, as I said earlier, it's not scientifically proven to treat cancer. It only allows the disease to progress to a stage that go back to the previous the people turning in late, presenting late, to a stage that is incurable. They might have operation, but then we have other challenges like the finance to come forward. Family finances are not as good to be able to bring them to the transportation, geographical problems. These are some of the reasons why they also turn to herbal, because there is a traditional healer in the village. I will go to them, with all the belief that it does. And when it's finally at a stage that they cannot bear, I cannot stand, they turn to the hospital. If I have a message to say, because please seek medical services first before you choose, because your decision to take herbal, it's your own choice. But with the clinical, you are monitored, and you are called frequently to the clinic to be able for the doctors and the clinicals to assess the level of progress of your condition, if you are improving or if you need to be admitted or have another level of treatment.
Mele, you've been through the journey. You started off and diagnosed with stage 1, and as you said, you didn't want to go back to the hospital for about 5 years, and turned to look at other options. What's your message to the people watching out there?
Thank you, Vijay. As what Nurse Karolina has said, for me, I totally believe she's true, because I was one of the witnesses who tried herbal in every way, but it turned out I ended up in the hospital again. I'm not saying that herbal is bad. It is scientifically proven that it's not the cure for cancer, and that's what happened to me. So I was trying this, I was trying that, and I ended up to the hospital. And what Nurse Karolina was saying is that because in the hospital you'll be well monitored, and everything, the facilities and everything at the hospital is more advanced. So my message too is for us this evening, yes, always go for the medical treatment first, and then you can go for other options later. Because in the hospital, everything is free, everything is provided, and also the everything is there is in advance, more advanced nowadays.
You were fortunate to have gone back with stage 4 and still get the proper treatment to have survived, Mele?
Yes, Vijay, I was so fortunate that the doctors are there for me, even though they knew that I came and revisited them again. But the services there was overwhelmed, and I was so blessed and so fortunate that I got the treatment, and everything was successful, and here I am today.
The treatment available, a lot of people may not know that level of treatment that's available locally, and then treatment that people have to go for overseas medical attention. What's the level of treatment here compared to overseas?
Mr. Vijay, well, you cannot compare us with overseas, but I would talk to our level, speak on the level that we have. Early detection has the best curative approach, whereby the doctors can just remove the lump and save your breast. Not all lumps will require a full breast removal. So, like when you think of why people are not coming forward and turning at a late stage, because the fear of having a breast removed, is always be the first thing that comes into somebody's mind. So I will be living with one breast. The stigma, those are some of the fears that sort of, but treatments are available locally, and we have some good doctors. As I said, we may just have to increase the numbers to be able to cope with the number of cases that are waiting for operations, because in our theater, not only breast cancer cases are being operated on, we have diabetes, you have obstetric cases, we have pediatric cases and fractures and all these things. So we need to be looking at increasing the facility in terms of the theater, the nurses that will operate there to assist the doctors, and also we have the steps will be from identification, confirmation of the lump, and the biopsy. Once diagnosis, the doctor will look at how serious is your condition to be able to book. If it's urgent, then they'll put you first, then see the other one that is still okay, it'll come later. So the list will be there, but the surgery will be according to the urgency of the cases that need to be there. So treatments are available. Chemotherapy is available in Fiji. Yesterday, just a gentleman came into my clinic and requested to know more about breast cancer. So if you have the money, he has the money. And he's saying next week, Wednesday, he's taking his wife to overseas to India for treatment, just a breast lump. So the difference is who has the money, who does not have the money. We don't all have the money, okay? And then some are covered with insurance who can afford, and some are not. So come when the lump is just been identified and your treatment is done locally. You don't need to have lots of money to be able to be sent overseas. Okay, so we have the treatment available, we have the services here. The only thing we'd like to advocate for, come early.
Now, Mele, you were treated fully locally here?
Yes, I was treated fully at CWM hospital.
So you are a living example of some of the treatment even available at stage 4 that can be done again if your people are willing to come forward.
Yes.
And you have the person, how long did it take for you to get to surgery after you went back with stage 4 cancer?
My surgery, it took only 2 days to be in the hospital, and I was discharged on the 3rd day.
My final question is in relation to family support. You talked about that a lot. That's critical in terms of emotional well-being as well. Support from the health sector and the support from the nation as a whole for those who are affected by this. We will go into funding and other medical needs that we need, Cancer Society, what more it needs to do. But from the perspective of an advocate and a person who's gone through this, what do you think needs to be done? Where attention is required as far as ensuring services are readily available and awareness is there for the people who need it?
For me, as my personal experience through all this, I can honestly say that the Fiji Cancer Society has done a great job for the survivors. Even the hospital, the medical teams, their services was too good, and so that was the first stage that I went through from the hospital side, and then after surgery, Cancer Society is there to support us in every way, like coming to our clinics and our reviews. They support and provide with transport, and they give medications where we don't go and buy. In the pharmacies, they do the financing of our medicines and our tablets, and moreover, they even to palliative patients, they provide diapers, they provide bandages and the dressings, and even they visit door-to-door homes and provide us with groceries for those who are unfortunate, with the mothers lying in bed, and they do all this help to help families who really in need.
Ms. Karolina, you definitely touched on family support. My question, since you have come from the health sector, you continue to Fiji Cancer Society that receives no assistance from the government in terms of funding, a critical area of work that you do for the whole nation. An issue in relation to the recent brain drain and how it's affecting these kind of areas as well, and in terms of ensuring that we have proper care and facilities available. What is your message to the people, and what is your message to the people who would have watched the show tonight if they want to come forward to also assist the Fiji Cancer Society?
Thank you, Mr. Vijay. Yes, for Fiji Cancer Society, probably I would just like to brief very quickly on what work does it do. It is there to support people who live with cancer, irrespective of the types of cancer. So the funding that we get from generosity of the nation, the people of Fiji, we utilize them to reach these people who are living at home. They are affected by geographical settings, financial ability to visit the clinics, to buy medication like Mele said. And then again, in terms of early detection, there is a big brain drain that has happened in the few years lately after COVID, that people are moving away. And these are the people that are skillful and have been trained to do these services. Unfortunately, this has happened. Maybe the government will need to be looking at funding, training, and provision of equipment. So if you train a nurse, you need to equip her with proper equipments to be able to deliver the services. And then other policies that need to be put in place so that once they are detected, they need to go through that process of referral until the treatment is done. Okay? And then funding, yeah, we take time to thank everybody who's been pulling out from their pockets to support us, and we reach them. Like Nell has said, at home, there are breast cancer cases that are coming out, the wound still open, they need dressings. They don't have at their old age, in the 60s, 70s, some even, they cannot afford to be coming every day to dressing. So Fiji Cancer Society, in partnership with Ministry of Health, oncology unit staff, we visit them. And we are grateful to Kontiki Finance for giving us transport that enables us to reach, and of course Tapus that provides the fuel card for our vehicles and us commuters as well. These are some of the things that we may need to look at or may need to request the government. or give us transport, or probably give us some of your medical professionals to help us reach these people. Okay, and yes, you talked about funding as well, and like I said, we were just fortunate a week ago that we've been promised to have some funds from the government. We are grateful, and with what's coming from the community, and like today, Pinktober, the month that we do merchandise for selling, that helps us fund the programs that we do.
There you go. You can contact Fiji Cancer Society if you want to lend a helping hand to this worthy cause to ensure that we have more survivors, that the fight continues. And we also as a nation have to ensure that we continue to push for proper funding for organizations like this, and to ensure that enough is provided to the health sector. We will be talking to the Deputy Prime Minister and Minister for Finance, who has assured the Fiji Cancer Society that after many years of no funding, that is expected to change. We will be asking the questions how that will change, and also the issues in relation to proper medical equipment, proper training, adequate staffing, and keeping in mind the issue that we have in relation to the recent brain drain, which has really affected our medical sector. That's our show for tonight. Until next week, have a great evening.